Hi there. And today I wanted to tell you about the mini course of the Next Level Consultant Pharmacy program. Just a quick overview and a little bit about myself. My name is Lorraine. I am a pharmacist slash consultant pharmacist. And I say that because in Florida, you need a separate consultant license to practice as a consultant. In most of the other states, you do not. You can, once you're a pharmacist, for example, in Pennsylvania, where I practice, once you have a pharmacist there, you can practice as a consultant. Anyway, this course is all about how I um, consult with surgical centers. And I'm going to take you to step by step, very briefly though, as to how I do my pharmacy consultation. But first off, um, why start your own consulting business? Well, for me, it came from necessity. I needed to make some extra money because I had a life changing situation. And I looked around and wondered what could I do while keeping my full-time job. I wasn't looking to give up the job I currently have. I was looking to add more income. So whatever I picked, it had to be something that I could do while keeping my full-time job. So I found consultant pharmacy and consulting with Surgery Center for me was a perfect fit because of when I had my days off from my full-time job, I could go in and consult with the surgical centers. So it was a real blessing for me, and it's been an amazing opportunity for me. So let's start so if you're interested in starting your own pharmacy consulting business, the surgery centers, you're in the right place. So how do you start your own consulting business and why? Basically, you just start. You get the information, you decide that you're going to do it, and you just start, right? Um, so for me, what I did was I started looking online to see what I can find, who has done it before. And I did find someone who was actually um, working with surgery centers already, and I got some information there. And it took me a couple of years, about 3 years, until I felt totally comfortable with my consultant work that I was doing, that I was providing adequate services for the surgery centers before I really felt comfortable. And so, having done this now for almost 10 years, I decided there may be other pharmacists out there like myself who would like to get started on consulting to surgery center. Let me save them the 3 year learning curve that I went through and just present the information, how I learned it, how I understand it. And then you can always tailor make it for for your practice. So I said, why start your own consulting business? Again, it's a plan B, gives you extra income. You may be retired, you have extra time, you don't know what to do with yourself, or you may just love to consult. And so this is a good opportunity to do that. So I will tell you the 3 reasons I became a consultant pharmacist. Number one, I needed to make extra income. Number two, I love working with people. And in surgery centers, you get to work with nurses, the staff there, and you actually witness them providing patient care. So that's pretty cool. And then, fortunately for me, in the state that I am in, they require surgery centers to have a consultant pharmacist visit the facility monthly. So for me, it was a really good fit, and it basically checked all the boxes for me to help me be motivated and get started. So I'll be talking about that in module one, giving you a little bit more information on that. Module two, I will be telling you how I got my first client, and it was from my website. That's how I got my first client. And so in the program, I will go into detail. Now, this was almost 10 years ago. There are other ways that you can get clients, but I got my first client from my website. Um, I got clients from going to surgery center conferences. I got clients from cold calling, just showing up and introducing myself. Now I get clients the best way possible, and it's from referrals. So, as you work with surgery centers, you will find that there's somewhat of a turnover of staff. And if you're around long enough, you will work with someone at the surgery center, and next thing you know, you get a call that they're at a different surgery center and they are want your services. They felt that your service was very good and thorough. And so they want to get you into where they are because they can see um, the need for your service. So I find my potential clients, like I said, through my website, from referrals, from cold calling, calling people on the phone, and from attending conferences. But there are many, many ways. So, a little bit about my website. It was a very simple website, nothing fancy. And it really helped me out a lot. It put out there what I did. And so before someone would call me for potential consultant contract, they already know about me and what I did. So to start your business, I would suggest again, like the website, LinkedIn can help now. Most of my potential clients are on LinkedIn. They're really not on Facebook. You need to also have a business card. The business card is something that you can give to people. It's kind of old fashioned, but it still works. I've gone to conferences and had many people call me and say, oh, someone gave me your card, or you gave me your card. Let's talk. So it's been really, really helpful for me to have a business card. So if you decide to go into this business, I would encourage you to do the same. Um, so this is where, in module 4, this is where the rubber meets the road. And it talks about the different aspects of what you'll actually be doing as a consultant pharmacist in surgery center. So for example, you'll be performing the facility audit. That's where you go and you check their controlled substances. You must do an audit whenever you go in, and it must be done with a licensed personnel, an RN, a physician, anesthesiologist can perform the audit, facility audit of medication controlled substance with you. You also need to create a policy and procedure manual for the facility. If it is an existing surgery center, they will already have policies in place. So you would just need to review those and tweak them if there's something you're changing so that it reflects your practice. Because the policy and procedure manual basically is what it says. What is your policy and how do we execute the policy? So that's very, very important. And in my program, it comes with a set of policies. And again, like I said, you can tailor it for your needs. For me, I had to start from scratch. I had to create my own policy and procedure. And that took me a very long time, like months. And I kept reviewing it until I got a hold of an existing one. And then I thought, oh my gosh, this is so much easier. So I would give you in this program a set of policy and procedure manual for pharmacy consultant in the surgery center. Arriving at the surgery center, I'll tell you exactly what you need to do when you arrive, because the surgery center is a very busy place. If you've ever been to one, there's usually a lot of activity on a day when they're seeing patients. So you want to make sure that when you get there, that you assess the situation. You tell them who you are. After a while, they will know who you are. I always make it a point to go and say hello to the administrator and the business people, because after all, they're the ones who cut my checks every month and pay me. So you just want to be respectful of them, and also the nurses as they're running around doing their job. You go in and you can start doing what you can do on your own to start your 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 checklist. And I would just usually mention to the nurses, when you have a moment, we just need to do the audit check. You don't have to do it now, because I really want them to know that I'm respectful of their time. And if they have a patient that they have to get ready to go back into the surgery suite, they don't have time to stand around chit-chatting with me. And or a patient may have just come out of surgery, so they need to be right there with that patient. So taking all this into consideration is really important. And I did not know that. I just kind of intuitively learned that as I started to do my consultation. So another important piece of your pharmacy consultation is to have a compliant binder. And in that binder, in Florida, there's certain documentation that you must have when you're operating a pharmacy in a surgical center. You actually have to get a pharmacy license. It's an institutional modified 2B license that you get for the surgical center. Some facilities, if they're not open yet, they may need you to help them with the application process of getting their pharmacy license. So I can tell you how you would go through that process to help them get their license. And in the compliant binder, if the Department of Health inspector comes out to check the facility for compliance, you want to have everything that the inspector needs in that binder, and you want to have it organized. And I will show you how I organize my binder and in what order. And I know I do it right because I actually checked with the inspector and asked her exactly what works for her and what would make it the most easiest way for her, an expeditious and thorough way that she could audit my facilities. And so she told me what she liked and where she liked it. And so all my binders are set up like that. There's a quality assurance chart audit checklist. I actually, depending on the volume of cases the facility is doing, I will audit their patient's charts. And I have a chart audit checklist, and that checklist has certain key indicators on there. And it helps me to do a thorough job, especially when I'm auditing for narcotic and controlled substance usage. I also have a folder that tracks expired medication. It's a log that tracks expired medication and helps you to keep track of the medications that are expiring. So you do not have to go through the whole inventory every month checking for that. Again, cross-checking of controlled substance documentation. I checked on that under the quality assurance chart. And there's an inspection area checklist, which you will get with the course. And it tells you, it goes through point by point what you need to check for in the facility to make sure you're not missing anything. Continue with the things you need to do. So I actually have two different checklists, and it depends on which one you prefer. So I have both of them in the course. If you are going through potential issues review of checklists, so if you're going through your checklist and there's a problem, the last thing you want to do is to tell them, hey, you did this wrong. You need to be very diplomatic, but firm, and let them know of any potential issues in an educational way, because we are there to support